Importance of financial statements in the healthcare sector. Financial statements play a critical role in the healthcare sector for several reasons, which include 1. Providing insight into the financial health of healthcare organizations. Financial statements offer valuable information about an organization's financial position, profitability, cash flows, and changes in equity. This information allows stakeholders to assess the organization's financial health and make informed decisions about its operations and future direction. 2. Assisting in decision-making for managers, investors, and other stakeholders. By examining financial statements, stakeholders such as management, investors, and regulators can evaluate the organization's performance, identify areas of concern or opportunity, and make decisions based on data-driven insights. This can lead to more effective decision-making and improved organizational performance. 3. Monitoring and evaluating financial performance and resource allocation. Financial statements help healthcare organizations track their financial performance over time, allowing them to identify trends, assess the effectiveness of resource allocation, and make adjustments as needed. This ongoing monitoring and evaluation process is vital for ensuring the organization's long-term sustainability and success. 4. Ensuring compliance with regulatory requirements and reporting standards. Healthcare organizations are subject to various regulatory requirements and reporting standards, such as those established by the Centers for Medicare and Medicaid Services, the Joint Commission, and other accrediting bodies. Financial statements are essential tools for demonstrating compliance with these requirements and maintaining good standing with regulatory agencies. In summary, financial statements are indispensable tools in the healthcare sector, providing valuable insights into an organization's financial health and informing decision-making processes for a wide range of stakeholders. Key financial ratios and their interpretation. Financial ratios provide insight into an organization's financial performance and can be used to compare performance against industry benchmarks and competitors. Here are some key financial ratios used in the healthcare sector. 1. Liquidity ratios. Liquidity ratios assess an organization's ability to meet short-term obligations. These ratios include the current ratio, quick ratio, and cash ratio. The current ratio measures the organization's ability to pay current liabilities with current assets, while the quick ratio measures the organization's ability to pay current liabilities with quick assets, in brackets, current assets minus inventory. The cash ratio measures the organization's ability to pay current liabilities with cash and cash equivalents. A higher current ratio, quick ratio, and cash ratio indicate a better ability to meet short-term obligations. 2. Solvency ratios. Solvency ratios assess an organization's long-term financial stability. These ratios include the debt ratio, debt-to-equity ratio, and equity multiplier. The debt ratio measures the portion of total assets financed by debt, while the debt-to-equity ratio measures the relative contribution of debt and equity to the organization's financing. The equity multiplier measures the organization's leverage or the amount of assets supported by each dollar of equity. A lower debt ratio and debt-to-equity ratio and a higher equity multiplier indicate a better ability to meet long-term obligations. 3. Profitability ratios. Profitability ratios assess an organization's ability to generate profits. These ratios include gross margin, operating margin, net profit margin, return on assets, and return on equity. The gross margin measures the percentage of revenue that remains after deducting the cost of goods sold. The operating margin measures the percentage of revenue that remains after deducting operating expenses. The net profit margin measures the percentage of revenue that remains after deducting all expenses, including taxes and interest. Return on assets measures the organization's ability to generate profits from its assets, while return on equity measures the organization's ability to generate profits from its equity. A higher gross margin, operating margin, net profit margin, return on assets, and return on equity indicate better profitability. 4. Efficiency ratios. Efficiency ratios assess an organization's ability to use its resources effectively. These ratios include inventory turnover, days sales outstanding, and total asset turnover. Inventory turnover measures the number of times inventory is sold and replaced during the period. Days sales outstanding measures the average number of days it takes for the organization to collect payments from its customers. Total asset turnover measures the organization's ability to generate revenue from its assets. A higher inventory turnover, lower days sales outstanding, and higher total asset turnover indicates better efficiency. Financial ratios are essential tools for evaluating an organization's financial performance and can provide valuable insights for decision making. Healthcare organizations can use financial ratios to assess their liquidity, solvency, profitability, and efficiency, and make informed decisions to improve their financial performance. Using financial statement analysis for decision-making in healthcare organizations. Financial statement analysis provides valuable information that healthcare organizations can use to make informed decisions. Here are some ways healthcare organizations can use financial statement analysis for decision-making. 1. Evaluating the financial health of healthcare organizations. Financial statement analysis can provide insights into an organization's financial health by evaluating its liquidity, solvency, profitability, and efficiency. This information can help managers identify areas of concern or opportunities for improvement. 2. Comparing financial performance against industry benchmarks and competitors. Financial statement analysis can help healthcare organizations compare their financial performance against industry benchmarks and that of their competitors. This information can help organizations identify competitive advantages or disadvantages and make informed decisions to improve their financial performance. 3. Assessing the financial impact of various strategic initiatives. Financial statement analysis can help healthcare organizations assess the financial impact of various strategic initiatives such as mergers and acquisitions, capital investments, and cost-cutting measures. This information can help organizations make informed decisions about whether to pursue these initiatives and how to implement them effectively. 4. Providing information to external stakeholders. Financial statement analysis can provide valuable information to external stakeholders, such as investors, lenders, and regulators, to support their decision-making processes. For example, investors may use financial statement analysis to evaluate the organization's potential for growth and profitability, while lenders may use it to assess the organization's creditworthiness. Financial statement analysis is a critical tool for decision-making in healthcare organizations. By providing insights into an organization's financial health, comparing performance against industry benchmarks and competitors, assessing the financial impact of strategic initiatives, and providing information to external stakeholders. Financial statement analysis can help healthcare organizations make informed decisions and improve their financial performance.